Thank you, Ranking Member and Chairman. Dr. Walensky, if you don't mind, retrospectively, what do you feel the impact of lockdowns were on mental health in this country?
It's certainly the impact of lockdowns resulted in lives saved from COVID-19, and also challenges in connectivity. And there are reports of some children doing better in school at home, but also some children that are losing.
My question is mental health.
Yeah, right, and the lack of connectivity and challenges in mental health. And we saw increases in mental health challenges before the pandemic. They were rising before the pandemic, and certainly the pandemic.
So you're saying the lockdowns had no impact on mental health?
No, I'm sorry, I'm not saying that. What I'm saying is that the impact, when you lose 1.1 million people in this country, there's tragedy, there's loss. There was loss of lives, there was loss of housing security, food security. All of these things impact mental health.
Thank you. Ms. O'Connell, recently we released a 300-page report on the origins of COVID. Senator Burr helped run that investigation. I want to give credit to the previous ASPR, Dr. Bob Cadlick, and his great efforts as well. That report says that there's a preponderance of evidence that shows that this virus was accidentally released from a lab in Wuhan, and a significant amount of evidence that would suggest it was actually made in that laboratory in Wuhan. As ASPR, what are you doing to research that same issue? Do you feel it's important that we know the origins of COVID?
So this has not been in the purview of the work that I've done at this point. But I'd be happy to take this back to the department and other colleagues that are taking a look at that.
Do you feel like it's important that we know where this virus came from?
I think it would be useful to know for sure, and I know that that work is underway. It's not being done in ASPR, so.
How would it be useful?
Well, as we work to prepare for whatever comes next, which is my job, it would be important to understand what I'm coming up against. But let me be clear, whatever it is, I'm responsible for responding to it wherever it came from.
So if a virus was made in a laboratory, your response might be different than if it came from nature.
Well, I think it would help us prevent it from happening again if we knew the source. Regardless of that, my responsibility to the country is to help them respond to whatever comes next.
Okay. Dr. Califf, I think my next question is for you. I mean, you can punt it on if you want to. The NIH did an incredible job in the early days of this COVID pandemic, sequencing the virus and then releasing and then sharing that with any group that they wanted to, any corporation. At the end of the day, 2 or 3 companies end up with a vaccine that was workable. Why did the other companies fail? Was there anything that we could have done to help promote it to other companies to be more successful? Why did we end up with just 2, maybe 3 vaccines?
That's a really great question. I wish we had like 6 hours to discuss it because, I mean, as you well know, 90% of drugs that enter phase 1 don't make it to market because Mother Nature is much more sophisticated and complicated than our brains are as we devise new therapies. So I think it was wise of the government to make a bet on 9 or 10 vaccines, and 2 or 3 made it. We often forget about the ones that didn't. I'm not sure that anything we could do would change that equation because that's pretty much the equation that we're seeing. That's why we have to do human clinical trials. We develop a therapy. We think it's going to work. All of those 90% that don't make it, somebody thought it was going to work and somebody invested. I think Senator Romney used to, I guess you didn't invest in these things. But so
I tried not to.
You have to take account of a high failure rate in this, which I think the government was very wise to do that.
But there's some value that took what the government developed to getting it across the finish line. Not everyone was able to do that, and I'm not sure what the value is in being able to do that. But you would agree that there was more than just luck getting that across the finish line for those 2 or 3 successful companies.
Oh, the collaboration and the mRNA platform that had been developed over decades and the sharing of the viral sequence, just the ability to do the viral sequence and then to use in silico methods to match vaccine to virus. That was an amazing feat of science and collaboration that made a huge difference. We would have had maybe 1 vaccine out of 10, I think, if the mRNA technology had not.
And some of the companies already had done significant investment in the mRNA technology before the COVID was even around, right?
That's correct, and that's why we're excited about new platforms that are coming along with regard to cell therapy and gene editing and other areas.